The spine service at HSS has a long and storied history. It's one of the top spine surgery services with over 4,200 cases being performed here a year.
The academic and educational opportunities at HSS are unparalleled.
We have so many elements of spine surgery with leaders in the field, providing the fellows with the best possible experience.
I consider it to be the most diverse and well-rounded fellowship in the country in terms of the breadth and experience that the fellows get to participate in.
The diversity is in research, diverse clinical care, diversity of attending physicians.
The sheer volume of patients that we treat here makes us the premier destination for an athlete seeking care.
An intense fellowship in the sense the amount of work that's required. In the end, the payoff is tremendous for the fellow.
And the mission is to train the next generation of leaders.
You come in and around, between 6 o'clock and 7 o'clock. You also get your notes written then.
We update the attendings and we formulate a plan and make sure that that is in line with what the attendings are thinking.
And then most days we have some sort of academic conference between 7 and 8 o'clock.
Then we head to the operating room around 8 o'clock.
The number of attendings that they operate with is designed to optimize their experience.
The attendings are extremely deferential. We get a lot of autonomy, a lot of ability to generate our own surgical skills in a good environment while giving good care to the patient.
We incorporate elements of spine surgery that are multifaceted, so including things like spinal oncology and pediatric spinal deformity.
Last week, I was doing a T11 to pelvis posterior spinal fusion with Dr. Kim, completely open with freehand instrumentation, and I was doing minimally invasive surgery with Dr. Qureshi using tubular approaches for decompression and putting in percutaneous screws in with assistant guidance.
We have such a nice balance of mentorship. You get to see really spine surgery as a whole, and then just how willing attendings are to talk to you about everything spine surgery to life.
When I'm working with my partners up in Chelsea Piers, we have physiatrists, we have sports medicine docs, we have foot and ankle. We're all working next to each other.
We have a tremendous amount of minimally invasive surgery that the fellows get to learn. And on the other spectrum, the deformity experience is second to none.
That is very collaborative, not only with research, but also with the pediatric side of spinal deformity and scoliosis.
One of the special things we have as part of the program is an initiative called the Athlete Spine Injury Program. The challenge of treating athletes is that they're elite, and what makes them elite is that there's not that many of them. And to have that conversation in a really informed way takes a lot of cross-disciplinary collaboration.
Then we also work at the Memorial Sloan Kettering Cancer Center.
We would do anywhere from 2 to 4 cases a day. After that, you check up on all your patients before you go home and get ready for the next day.
I wanted to really go into academic medicine, and a place like HSS is the greatest tertiary referral center in the country. We just get an incredible teaching experience.
Priority is to make sure that we train people who are going to be thought leaders.
The first thing that they do in the morning is they go through their morning conference. The first one is a radiology conference with the head of spine radiology, John Carino. We do our research meetings with Dr. LaFage. She's the leader in deformity thinking.
When it comes to the indications conferences, to have some of the great minds in spine currently, to have all those voices in the room together is something that I think is unmatched at any other institution.
You learn about the thought processes of the different attendings and how they would apply this to clinical practice.
These are leaders that have written the textbooks and some of the most important articles that we read that really drive the field.
If you want to get the most out of this fellowship, every single patient that you see, you have to treat that patient as if they're your own. You have to have a high level of accountability. You have to feel and do everything and think in a way as if that was your own patient, because next year you're going to have to make these decisions by yourself.
We have a robust research program, both in minimally invasive surgery as well as spinal deformity. The research opportunities include translational opportunities as well as opportunities around database learning, machine learning, as well as clinical outcomes. Our research program is inclusive of a large research team so that you really get a feeling for how to perform research as part of a group.
And the net result of that is we have hundreds of publications and national presentations every year. That is a pedestal to enter a really prolific academic career.
We really expect our fellows to be able to participate from an academic standpoint while also achieving the best clinical experience in the country.
The BioSkills Lab is a great resource for our residents and fellows. We have sessions monthly where the residents and fellows are being taken through dissections with attendings.
Dr. Sandu has put together this research collaboration between all the different groups to come together as a group and actually have group-wide research meetings.
We have 2 alumni meetings here at HSS. Being one of our fellows, you're tapping into a tremendous network of people who not only are here today to train you and be your mentors, but other people who have been here in the past. We've trained 4 to 6 fellows for many years. We have an alumni reunion every summer, and so you're joining a big network of surgeons who have connections to HSS.
A fellowship in New York is really special because obviously New York is a tremendous city. There's so many things to do.
Walking along the East River at night, you have one of the most beautiful views in the city, and it's right here, at our back door.
New York brings together the best talent from all over the world.
The kind of person to come to this fellowship would be somebody who really wants to push themselves and to push the field to be better than it ever has.
One of the best things about working here at HSS is working with young fellows who are coming through in the most critical year of their training, the year that they're going to learn to become a spine surgeon. I feel like I learn as much from them as they do from me.
The Spine Fellowship at HSS could provide a multifaceted educational experience to our fellows with a tremendous amount of mentorship and collegiality that will be with you for the rest of your career.